All right, welcome back to Coast Live. So going to the dentist, for some adults even, it can be a bit nerve-wracking, but for children, it can be downright terrifying. So moms, dads, as a parent, what do you do when your little one maybe just refuses to open up and say, well, we have help from the expert. Bobby, I don't want to mess up your last name.
Garofalus.
Bobby Garofalus from Hampton Roads Pediatric Dentistry is here with some advice. Okay, so we'll forget the adults who are a little terrified for a minute. But, you know, as a parent, you have your little ones and you want them to be comfortable. It's important to go to the dentist. So what's your best advice to kind of calm the nerves?
So we encourage parents to bring their children young, even as young as 2, 3, 4, so they get acclimated to the whole dental experience. So the first time we have like a 2, 3-year-old, if they're refusing, we do not force the cleaning or anything. We try to desensitize them, acclimate them, tell, show, do. We have these nice dolls that we can demonstrate how we're going to brush the teeth.
Okay.
And then go from there, basically.
So you make friends first, and then you get into the business.
Right. We try to establish a great relationship first between the dentist, the parent, and the child. And, we emphasize it's a team effort, that there's not one blanket that works for every child. Every child's different, so their fears are different, so we try to tailor as to what we can do to alleviate the fear as well.
When we're talking about procedures that the little ones might have to go through and trouble with their baby teeth, is it even necessary to sort of fix or fill those?
And that's a good question. A lot of parents do ask us, is it necessary to fix baby teeth? And for the most part, it is, especially if they're not losing these baby teeth until 12 and there's caries at age 3, 4, 5. It is important because that can lead to dental pain, dental abscessing, loss of space. So we do try to save the baby teeth. However, if there is a cavity and the tooth is falling out within 6 months or a year, we typically will do a watchful wait and let the parent know, hey, this will probably fall out, no worries, we'll keep an eye on it, and it should be fine.
So we have that under control. When you get them in there, you decide it's time to do a procedure. Do you have any special methods that you use while you're in there when they're in the chair?
So again, every child is different. There's not one blanket that covers every child. So we, again, assess the child, the parent, what their expectation is and what the treatment is. If they need one small filling and they're scared, we'll desensitize them before, bring them in for a tell, show, due date, show them how we do a filling on their fingernail, paint it over there, and then proceed from there. If that's still not enough, we do have other methods that'll help alleviate the child's fear.
And when we're talking about things like cavities with kids, as an adult, I hear the drill, I freak out.
Right.
So are there any sort of non-invasive ways that you can get around that?
With the sound of the drill, or
when it comes to filling cavities?
Right. The most non-invasive way is watchful waiting, meaning we will keep an eye on it, we'll paint some fluoride on it. A new method coming out is called silver diamide fluoride, which is a great material which will actually stop the cavity from spreading. If we need to buy time, if we need to get the child more comfortable, we paint this material on the tooth. It'll stain the cavity black. However, it'll stop the cavity from progressing, and that's one method that we're starting to employ at our practices about arresting cavities.
That's huge.
It is. I mean, it's not for everyone. That certain procedures it won't work for, meaning if your child comes in and there's a huge cavity and they're in pain, you're beyond that point. However, if we have a small cavity on a 4-year-old, we need to buy some time to get them a little bigger. It's a great method to prevent it from spreading.
Now, do you have any advice for, say, grown children who still, after all these years, might be a little terrified?
In general, I mean, just going in with an open mind, expressing with your dentist what your fear is. I think if everyone's on the same page and you tell them, this is what gets me nervous, I don't like laying back all the way, I have a bad gag reflex, what are my options? And I think from there, establishing a good rapport with the dentist will definitely help even big kids get through the experience.
Big kids, like the way you put that. Are there options for people with gag reflexes? Because that's a thing.
Absolutely. A lot of kids we see now, they have gag reflexes, oral aversions. They don't like certain tastes and textures. So we employ a nice method called conscious oral sedation, which basically you give them a low-dose benzodiazepine. It helps relax the muscles in here to prevent the gag. It gets them over the certain textures and tastes that they don't like, and it's great even for non-invasive procedures such as cleanings, sealants, small fillings in the back where a child might have difficulty tolerating it.
Gotcha. Well, there's so much we have learned today, and I think the bottom line for moms and dads out there from Hampton Roads Pediatric Dentistry is that we're in this together.
Absolutely.
Everyone's going to hold each other's hands through it, and we'll get through it.
And that's the best advice you can give.
There's the information, hrpediatricdentistry.com with the phone number. Thank you so much for joining us today.
It was nice meeting you. Thank you very much.
Great to meet you as well.